Agenda's approval of the agenda. The chair will entertain a motion.
So moved.
Thank you. I hear a motion and support. Any questions on the agenda? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. Now public comment is open. Public comment guidelines, each individual will state their name and have 3 minutes to address the board. Subject matter should be pertinent to the items on the agenda. You may only address the board once under this public comment opportunity and might not yield your time to others. Board members will not debate or answer questions at this time. Public comment is now open. Last call for public comment. Thank you. Public comment is now closed. We move now to committee items. First item is the minutes from last month's meeting. The chair will entertain a motion to approve the minutes. Thank you. I hear motion and support. Any questions on the minutes? Hearing none. All those in favor will please say aye. Aye. Any opposed? Thank you. And now we move to appointments. I need to open it up. This month we have an opening on the Veterans Affairs Board for a veteran for a term expiring in March of 2030. Current member is James Ducey. We have applicants James Ducey, Carissa Barton, and Kenny Price. Chair will entertain nominations. James Ducey is nominated. Any other nominations? Hearing none, all those in favor of James Ducey will please say aye. Aye. Any opposed? Thank you. Mr. Ducey will be forwarded to the full board with a recommendation for approval. Now we move to Lifeway's quarterly report, and Shannon Clevenger is here. Thank you, Shannon, for being here.
Thank you. Good afternoon, Commissioners. I'm here to just do a review of the report that you received from Cassie. And so I just kind of wanted to get into some activities and celebrations that we've had. We had a board member, Ed Woods, Mary Beth Leonard, who's our retired CEO, and Mike Thompson, the CEO of one of our providers, Segway, were honored at the City of Jackson's 2026 State of the City event. They were awarded keys to the city by Mayor Mahoney in honor of their contributions and longstanding commitment to the City of Jackson and the behavioral health sector. Extremely proud of all of them. I wanted to do an overview of our staffing levels right now for fiscal year 26, quarter 2, which would have ended in March. We have an average of 242 employees in that quarter, a voluntary turnover rate of 1.10% with a total turnover rate of 1.38% during that quarter. And our average years of service right now is 5 years across the staff. Service delivery in Jackson County, Lifeways and its network providers completed 52,815 face-to-face services for 3,631 individuals. It's an average of 15 services per distinct consumer during that time frame. The highest number of services by type were our community living support service, supported independence programs, case management, assertive community treatment, respite, outpatient therapy, and psychiatric services. Under our quality improvement and assurance activities, we completed the MDHHS Office of Recipient Rights required site visit assessment in January. We did receive a score of less than substantial compliance due to some primarily centered issues around policy and procedure documentation updates. There were no findings to Lifeway's operation of the educational and investigative or prevention work of our Office of Recipient Rights. There were some language changes that happened at the Office of Recipient Rights at MDHHS, and our procedures needed to be updated with that actual language. So that actual corrections have been occurred. We completed our financial audit with no substantial findings. We are now completing the Deficit Reduction Act compliance audit. It's anticipated to be completed in late April, early May, and the findings of both of those audits will go to our June or July board meeting. We completed our 2026 Crisis Residential Unit licensing review in February. We had 3 areas requiring corrective action related to emergency preparedness drills, resident record keeping, and evacuation assessments. All corrective action plan activities were completed in February of 2026, and Lifeways achieved a 2-year license renewal for its crisis residential unit housed in our building on West Ave. Lifeways completed a Health Insurance Portability and Accountability Act risk assessment between December and February. The compliance score was 79% with 10 areas to work on. The assessor found that Lifeways had a strong foundational security posture while also requiring some additional policies, processes, and monitoring activities to strengthen its risk mitigation. And this is around technology and security around technology. Central Michigan 211, which operates through a partnership of United Way and Lifeways, completed its accreditation audit and achieved a 5-year accreditation. And our millage services in Jackson County, we served 38 individuals in the community during that quarter, which would be January to March. And we provided 231 we provided services to 231 distinct consumers that were in the jail, the Jackson jails during that same quarter. And then also just to highlight, if you have not been keeping track of the news, the HR 1, which is also the One Big Beautiful Bill, the initial phase of changes relative to Medicaid eligibility and the work requirements are set to take into effect January 1st, 2027. So we are working currently with our network benefits and our provider network to try to make sure that things are in place for individuals relative to those changes, as well as any advocacy we can do on our part related to the individuals that we serve and the burden that that may have on them and the issues that may come from them coming off and going back on Medicaid during that period of time when those changes happen. And those would be the updates that I have for you today.
Questions for Lifeways? Commissioner Bear.
Thank you. Your millage services. You provided services to 231 individuals in our jail.
Yes.
What's their jail population?
I don't know what the jail population is. Yeah.
Go ahead, Commissioner Shotwell, please.
I get a daily report out of the jail, and we typically have between 250 and 300, depending on population. They rotate in and out of there in less than 2 years because any sentence greater than 2 years must be served at a Department of Corrections facility, where it has less than 2 years, it can be served at the Sheriff's Department.
Thank you for your
Okay.
answer.
Well, and basically, millage services are those that are not covered by Medicaid.
Correct. While they're in the jail, they are not Medicaid eligible. So millage services are used to individuals who are being currently incarcerated if they have psychiatric needs. So we have therapists that are in the jail providing services. Yep.
Please.
So you mentioned you're anticipating some people are going to have a transition issue.
With Medicaid?
Right.
Yes.
So is there a plan to where they could receive temporary treatment without having to pay so they don't?
Not necessarily without having to pay. So we are required to do an ability to pay or a sliding fee under our CCBHC, and we have our millage services. So we have to do the ability to pay regardless of your funding.
Okay.
And so depending on your taxable income, you could have an ability to pay for service or not.
All right. I guess the better way for me to put it is no one's going to get cut off. They'll at least have some form of option, whether it's to.
We would provide services under the CCBHC model for CCBHC eligible services, and then the millage for those non-CCBHC eligible or qualifying individuals.
Thank you.
Yep,
But we do try to keep people on Medicaid if we can.
absolutely, and
If
that's
they-
what
if
our
they're qualified,
benefit
certainly.
specialists are going to work on. Yes.
Right. Other questions? Chair will entertain a motion to receive the report. Thank you, Commissioner Snell and Commissioner Willis. All those in favor will please say aye. Aye. Any opposed? Thank you, Shannon.
Thank you.
And now we're up to the medical care facility, their monthly report. Madam Director, good to see you.
Hello. Okay. So today for my report, I'm going to be focusing on quality and our quality metrics. We did not have any financials for this month approved by the board, so I don't have that to present to you at this time. But I did want to focus on our 5-star rating and how that's created and share a little bit with you about a recent survey that we had. So if you could move to the next slide for me. So this is a slide that I share with you each month. You'll notice that there's been a change in our ranking here. We had been ranked at number 1 for our market area due to a survey that we had in January and closed in mid-March. We have had a drop in our survey rating. And then you'll also notice that there's a red hand attached to our facility. And I just want to talk a little bit about what that means. You'll notice if you look at the other facilities, there are several other facilities in town that also have this red hand. So this red hand indicates that these homes were all cited for some form of abuse or neglect. So I want to explain how that works in long-term care and what they look at for that, because we did receive a citation for neglect in January. This is all public information, so everything I share here is available online. You can look it up. We had an individual who requires 2 people to use a lift to assist them from the bed to the chair to the bed, anywhere that they're transferring to. In this particular instance, we had a CNA that chose to transfer this person with 1 person instead of 2. The resident had an injury, which is what resulted in the citation. We reported it to the state of Michigan, which is our requirement under our facility reported incidences. So when that happens, the state comes out and they investigate the claim. They look at our investigation and they determine whether there is something that didn't meet the requirements of participation, which is what our regulations are called. So in this case, they decided that we were to be cited with F600, which is abuse or neglect. So this red hand that you see here will remain on our profile publicly for the next year. And as a result of that, our survey score is capped at only 2 stars. So if you'll move to the next slide here, you can see previously we had been 5 stars overall, 5 stars or 4 stars in survey, 5 stars in quality, and 5 stars in staffing. Now, because of this citation, we can never be higher than 2 stars in survey until that red hand is removed from our profile. So overall, we lost 1 star in our overall market here, and then 2 stars in our survey area due to the citation that happened in January. We are still one of 3 homes with 4 stars. I apologize, there's a typo there. One of 3 homes with 5 stars in staffing, and one of 5 homes with 5 stars in quality. So those things have not been affected by that citation. We continue to have a fairly low nursing turnover rate, 13th lowest in the state for overall nursing, and 8th lowest in the state for RN turnover. If you move to the next slide here, I want to talk to you a little bit about how the regulations work around the term of strict liability. So in the past, when there was an issue where somebody didn't follow a care plan, as in this case, CMS would look at that and say that the facility failed to prevent an accident from occurring. And there is a citation for accidents and hazards. But under the previous administration, there was a change in how that was interpreted. So now, going forward, if there's any lack of following a care plan, it's automatically cited as a neglect tag, because the care plan is what determines the level of care that each individual requires. So if they didn't receive the care that they required, they were neglected. So I want to just share the difference in these standards, just so that you can fully understand how this works. So the current standard says that facilities are liable for all resident harm, regardless of whether we had policy in place, training, or supervision that was already in place. So even if your systems are set up to prevent this, we are still held liable. Intent and individual accountability is not a mitigating factor in how the citations are scored. So even if that individual fully understood that making that transfer with only one person was unacceptable and did not meet our standards and chose to do it anyway, the facility remains liable, even if we have all the training and documentation to prove that we had the system in place to prevent it. So public quality scores reflect the outcomes, not necessarily the strength of the facility's overall compliance infrastructure. So I think that's important for you as commissioners to be aware of, is this can be the case for any facility. They can have all of the compliance infrastructure in place, but all it takes is one individual who does not follow things exactly how you've laid them out to put a facility in this position. I want to share with you what the standard used to be, because I'd like to ask you to advocate for a return to that standard when you're talking to people.
Go ahead, Mike.
Just share with the board the importance of the stars and what the impact it potentially has on your facility.
So the star rating is what is publicly available for people to make determinations on the type of facility you are, whether you have high standards, whether you have high quality. It's used by the hospital systems to determine how many referrals they send your way, specifically in hospital systems that have a preferred provider network, which here in Jackson, we do have a preferred provider network. So you have to maintain a certain number of stars to be able to remain part of that network. And really, it is the mechanism that the government has set up for families to be able to be well informed about the quality that any nursing home offers. So having that understood publicly, what all this means, is very important to the facility and its ongoing operations.
Is there, it seems to me, I recall that if you're a certain number of stars, the hospital will refer, but if you're not that high, they will not refer. Am I correct? Am I recalling something properly?
So with a certain number of stars, you get preference in the number of referrals you get. If you're under that, you'll still get some referrals, but you'll see a meaningful drop in those referrals because they're going to go to those partners first. And part of that is because the hospital themselves have metrics that they have to meet, and they have what's basically the downstream impact of a person's care that they are also responsible for. So, for instance, a hospital is responsible for making sure that the nursing home doesn't send the resident back to the ER multiple times because that impacts their metrics. So they're trying to find the highest quality providers to partner with. So yes, it can impact those referrals. You might still get some referrals, especially in our market. We do have a lot of seniors that need care. And there was a period of time that we were not part of that preferred provider network and we were still receiving referrals, but we've seen a meaningful increase in census since we've become part of that. So yes. So what I would like to ask, if you're talking to people about these strict liability standards, particularly in Washington, is that to ask for a look at when there's documentation that training exists, the equipment protocols are in place and being followed, and the care plans are up to date with the residents' needs, that the facility be considered to have met its duty. That the individual who willfully disregards those systems should be held accountable, as opposed to the system punishing the facility who has put all these stopgaps in place to try and prevent it. That is something that the American Healthcare Association is working with CMS on and hoping to have some change in that interpretation from the strict liability standpoint. But just an analogy to try and help bring this home to make it maybe click with other areas of government or other areas of healthcare. If you could move to the next slide. A hospital, for instance, isn't penalized on its public quality profile when a surgeon violates a protocol within the hospital when they've been trained to do that and have it documented. A school district isn't rated unsafe because one teacher violated a policy that the district enforced. So in this case, we built a system with training, the care plans, the equipment checks, but we had an individual who chose not to use it. So this is why the strict liability interpretation is so impactful for nursing homes. And I think it's really something that you should be aware of as commissioners, the impact that it has on not just us, but all community homes.
With respect to the person who didn't follow the rules, what is the remedy for that person?
So in this particular case, the Certification Bureau is looking at their certification to see if they can remain working as a CNA, and they are no longer employed by the facility. But that process typically takes sometimes up to several years. I'm seeing that it is moving faster than it has in times previous. But during that time, while they're under investigation, they can continue to work in other long-term care facilities in the area, and they would have no idea that this has occurred. So that is also a risk for us as a facility, that we could hire somebody, have no knowledge that this has occurred at another facility here in town, and then later find out that they have done something like this at one of our competitors. So.
Thank you. Oh, Commissioner Bear, please.
Thank you. You said this was a new policy with a new administration, meaning the Trump administration.
Previous
The
administration.
the previous Biden administration allowed a great deal of abuse of veterans in veterans hospitals. And Biden administration just tolerated that for years. Trump came in and changed everything. They said there will be no more abuse of veterans in our hospitals. A lot of people lost their jobs. And this to me seems the same way. Biden administration tolerated certain offenses, and the Trump administration is coming in, is now having a zero tolerance policy, which I favor that myself. When people are in Veterans Hospital or in a medical facility, their families ought to be secure in knowing that their family members are safe. And that's why I like this zero tolerance policy for myself.
I think what the director has described is that as a result of the failing, that person is not employed by our medical care facility any longer, and that potential sanctions are being planned. That sounds like it fulfills that requirement. Would you agree, Commissioner Bear?
Well, there was also a statement that she wanted to help people influence that decision and roll back the policy to the previous one. I'm not in favor of that at all. We're not going to go back to a policy that tolerated certain abuse. I want a policy that zero tolerance for any abuse.
Commissioner Bear,
Thank you, Commissioner Bear. Okay, you may continue.
If I could, I think there might have been some misunderstanding. So it was actually under the previous administration, so under the Biden administration when this changed. But I 100% agree with you that abuse and neglect should be a zero tolerance rule. Now, I think where we may be seeing a difference is if there's systematic processes put in place to prevent it, and a person uses their own free will to violate those principles that have already been put in place, the facility has done everything that they could short of walking around with that individual to prevent them from committing any abuse or neglect. I 100% agree with you that there should be zero abuse or neglect. People should feel safe putting their families in facilities and getting the care that they deserve and that they need. I don't know if that helps kind of differentiate, but This was a change under the Biden administration, and the Trump administration is actually looking at making the change back away from strict liability.
Okay, I interpreted what you had said, the exact opposite of that.
No, I apologize. You're welcome.
Please, please continue.
So the last thing I had to share with you is I just wanted to share that this week is National Skilled Nursing Care Week. So we are going to be celebrating this week, celebrating our staff, celebrating our residents, and the life and joy that we can have even in a facility setting. So the theme this year is Moments in Bloom. So we're very much focused on our core value of elevating growth and how we can build each other up together. So with that, that is all my report, unless there's any other questions.
Further questions for the medical care facility? Commissioner Williams, please.
Thank you, Mr. Chair. Just one quick question for you, and I apologize if you did mention this, but in regards to the icon that we have now, the standard, if you will, is there a way to petition to have that removed sooner than the 1 year mark?
So we did file an appeal, but because of the strict liability standard that's in place, we were unable to win the appeal. So unfortunately, that does stay in place.
Okay, thank you.
Yep.
Nothing further, Mr. Chair.
Thank you. And the chair will entertain a motion to receive the report. Thank you. There's motion and support. All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank
Thank you,
you.
Destiny. And now the Veterans Affairs Semi-Annual Report.
Thank you, Commissioners. I'd like to first start off with a brief overview on our first cover page, or the second page of the slide. The Veterans Committee, and this is typo because when we submitted this, we were under the understanding that we had 4 full board members, but we didn't. So thank you today in advance for the approval of Jim Ducey. He's already been sitting on the board. He's very active within the veteran community, which is nice. So we're at 3 out of the 4. So with our board, we do have the American Legion coming in 2 days a week to see veterans to help with the caseload. And for 6 months, these numbers reflect the semi-annual. We answered 1,241 calls in the office, and we made 434 appointments. Those appointments range in different avenues of what we do. We do have an MOU with the Dearborn Vet Center for a social worker to come out and see veterans 2 times a month. And she offers one-on-one counseling for mental health. That is and all those notes go into the VA system too for their mental health counseling. So it's free to those people. I did attend a 3-day adversary training in Traverse City that was hosted by the Michigan Veterans Affairs Agency. It was 3 days of sitting with lawyers from the National Law Firm of Veterans, NBLSP. Very good training, a lot of law changes. It gave us an advocacy, a view from a lawyer standpoint, which helped.
What would be adversary training?
So adversary training, that's what basically a VSO
We all know how to fight with each other. I
Right.
guess I'd like to know
So
about what that's about.
it gives you the perspective from the lawyer's standpoint, because they find every avenue when it comes to us being true adversaries of helping veterans with their claims. It gives us a view of what the law judges are looking at and the cases that they have argued at the Board of Veterans Appeals. It allows us a little bit different way of looking at things to help veterans. It's usually when I worked for the American Legion, we had the same company, this law firm, provide training, and it's very good if you can sit through 3 days with the lawyers, because that's all you get, but you get a different perspective. And then we're working through right now this introduction of generative AI workflow. VA's going AI. So we're seeing tons of mistakes because you know how AI works. It takes everything from outside and in the VA world, implements it into a rating decision where it goes against the CFR and the M21 manuals that they work out of. So we're having to correct and show VA that, hey, this rating decision's wrong. So we review our rating decisions for our veterans. So we're working through this AI generation. It's getting better, but it's there. It's what we have. The next slide we have the appointments I was talking about in the front. You can see we have miscellaneous, which is the blue tab. That is kind of how we put everything into perspective of service connection and anything that doesn't portray a burial or a DIC or follow-up. It's mainly miscellaneous because that's the majority of our business, is that miscellaneous service connection. And that's the lion's share of it, but it kind of breaks it down on what it is. And then also we have I asked my administrative assistant to provide an overview of what we do in our office, because I'm sure we get the question, hey, what does your office do? And I'm sure with the commissioners being out there in the public, your constituents are out there may ask you the same thing. This maybe gives you something that you can say, hey, this is what our veteran office does. We went through the utilization authorization database, which is what we use right now is VetraSpec, but we also have access to the federal system, which is the VBMS and the SHARE system. So we have access to everything for veterans under the POA codes that we're accredited with. We assist with veterans in filing service-connected claims, supplemental claims, and helping prepare evidence and documentation required to file. That's where that advocacy training came into play. It gives you an idea of what the VA looks for and basically how to, not to manipulate it, but it's a different way of approaching claims. We also assist with veterans in reviewing their decision letters. I personally will tell you that a lot of our veterans want to come in and just sit down with us and can you explain my claim? Even though they were the ones filing it and we filed it for them, we explained it, they just don't understand because that's how intricate this VA world is. They don't speak in languages that me and you would speak. They speak with the law, and veterans have trouble interpreting those rating decisions, so we do that for them. And then also, debt is huge within the VA because if there's an error or the VA senses an error, they don't just debt for the day they found the error. They debt all the way back to the date that they started paying and provide the veteran the ability to bring forward the information, which is tough because some of these claims we're working a debt right now that's an 8-year debt for a 100-year-old lady for $83,000. So we're working through that right now.
So describe how a debt would arise in this realm. Is it that they are overpaid benefits in some past years?
The VA claims that they were overpaid because when they did the original application, the widowed spouse was in one of the local care homes, and the care home was providing the care. Well, then as she advanced to where she needed more care, they brought outside medical services in. Well, when they applied for that increase in the monies, the facility said, oh, we don't do anything but just monitor her medications. Well, you have to have at least 3 out of the 4 ADLs to qualify as a medical expense. So they said, oh, well, they don't do that. Well, they do, but the facility they only did medication because it wasn't filled out by the facility owner. So they went back and said, oh, well, we got to go back all the way back to 2017 and debt for all the monies we paid. You need to provide us that the care home provided this care. Well, we have it. It's just, I think we're up to 78 pages right now to send back to them for every year. We had to show them because they got new care providers. It's just the medical care that they're getting. So we have to bring it forward, but it's a lot. It's a lot. And we're really trying to assist them, but they feel if they think there's a flaw or a overpayment, they make a veteran go all the way back to the first day they were paid and bring that forward. So it's there's going to be a debt incurment, just because the son waited over a
There,
year.
there's no such thing as a statute of limitations of, 3, 5, 7 years, something like that?
No, the only thing they do is they do a 3-year look back, and that's the other part of the explanation of what I have to provide to them for the family is, hey, we shouldn't have to provide back to this. The day that this new care provider came in, they took on the responsibilities because of being fall risk. We had to. I'm saying we only have to provide for that day forward. They're trying to take out. It's a max benefit, so they're trying to say that $1,800 of her room and board doesn't count. But she's been put in a facility recommended by a doctor as a medical necessity. So they're trying to get out of counting $1,800 a month for room and board, which we're going to show the statute that they have to. It's just one of those webs we weave there to try to get through. But debt incurment is big, and a lot of times debt incurments are because there was a debt. There was a. I don't want to say a lie, but people
An
don't report.
overpayment of benefits of some sort.
Exactly.
Yeah.
When they fail to disclose it, they don't have any property, and all of a sudden they find out after they go through this whole thing that there's a property in the UP that's worth $400,000, which would make them ineligible because they have excessive assets. We don't know it because we ask, but so we're only as good as the information they provide. So you'll see debts from time to time. It's mainly on the pension side because it's all based on numbers for them. And then we do the healthcare enrollments. VA does not do their own healthcare enrollments. So if you walk out as a veteran to the Jackson CBOC and want to get services, they're going to tell you right there, they're going to hand you a piece of paper with our name on it, our office location. You need to go over there and make the application. We then have to send it to Ann Arbor's enrollment for them to be accepted. So it's kind of a system, but they don't have an enrollment out here, so they don't even, it's hands off for them. So we do that. We also do the VA pensions, which most people in this industry hate them because they're, what used to be an 8-page document can range anywhere from 30 pages now just for the application because it's so intricate. Once they involved a 3-year look back, it's just kind of like Medicare or Medicaid with the 6-year look back or 5-year. VA is now a 3. So you really have to really press them to make sure that we have all the assets that are accounted for, because if you don't, you could get yourself into a debt with the VA. So it's challenging. And then we also, one of the biggest benefits of all veterans that are active duty, that serve Title 10, which is the active duty poor hole, is the marker and application and burial in National Cemetery. We do the marker applications. We assist the family and make sure they know how to take the remains of their loved one and get them buried into one of the 2 national cemeteries here in Michigan, or anywhere they would like them to be buried in National Cemetery except Arlington because that's limited space. But so that's a huge part of what we do. We do a lot of them. We also work with the ME's office, Sarah, on unclaimed veterans' remains. We get those. She has them. She gives us a call. We get them and turned out to Great Lakes, which is a huge asset because, having unclaimed burials, these people deserve to be laid to rest. And then DIC benefits, that is a benefit provided strictly for the spouses of veterans who were service-connected and died of service-related conditions. This is a lot because this is primarily one of the biggest game changers there are when it comes to widows, because everything changes. The Social Security stops and the changes. This DIC benefit, if their husband passed away or wife passed away from a service-connected disability, they can get $1,699 a month in tax-free income for that dependent indemnity compensation. So it's we do a lot of them when we have a lot of deaths, but when we get the death certificates in our office, my secretary goes through it and she scans each one of those for their service. And if they've been in our system, and if we see that this veteran served in the Vietnam era, we do a cold call to the spouse and say, hey, did he have service? If we don't know, did he have service with boots on in the ground in Vietnam because he died of prostate cancer, which is an Agent Orange presumption? we actively seek out these spouses so that we can get them the benefits they so deserve. So that's one big thing there that we really watch at death certificates. And records request. We do a lot of SF-180s, which is a form that is put out to the National Record Center for veterans to get their records, their service records, their medical records. So that all is part of proving disability when it comes time. And sometimes these providers, when you ask a doctor to make a medical nexus, how do you ask a doctor if you don't have the proof that, hey, I had hearing loss in service, here it is documented. So we have to get those to help them. So we really assist them. So that's big. We do a lot of SF-180s. Also, if someone's looking for their dad or mom's discharge papers, because they just may want to join one of the service organizations and they don't have it, we can get them as next of kin to get those in, see if they're eligible to join some of the local organizations, which help veterans in the long run too. And then we also provide, in red here on this, is the community resource unique to veterans such as transportation services. We don't provide transportation services, but we have, the VA does out of the clinic. They provide rides to and from Ann Arbor VA, but there's other community partners, Catholic Services, the Jackson Transit. They provide transportation to local appointments. So we try to get them in touch with those local resources. And then Community Action Agency is one of our big partners because they have a veteran navigator. They have a homeless veteran coordinator, because they control all the SVF grants and that the VA provides. They do all the housing grants. So they do all that work with the Community Action Agency. So we work hand in hand to get these veterans to them. And Habitat's one of the big ones, because people always call, hey, I need a roof or I need a furnace. The federal government doesn't have any money for that. They don't provide through VA. But we do tell them, like, Habitat has some programs that are geared towards veterans. So we always do that warm, casual community handoff. We don't just give them a number. Call us. If you don't get any results, call us. We can help with our resources to help you guys with something else if we can. So, and that's one thing I've stressed to my secretary when she talks to people. They don't know. That's why they're calling us. So take a vested interest, and we do, on making sure that we help solve some of the problems they have locally. Other than that, that's pretty much the end of my report. I would entertain any questions if you have any.
Questions for the VA? If there's any one particular thing that we county commissioners, or that you find that you need, that we county commissioners can provide, can you, is there anything that we need to do to give you a hand with things you can't get done? And if you haven't got an answer today, think about it.
I don't think that we really have a inadequacy. Yeah, of course, a lot of the other counties are funded under millage, but this counties chose to do this as a general fund expenditure, and some of the other counties, but with that millage, they allow them to provide relief funds for veterans, whether it be purchasing propane or just small things or whatever. We don't have that here, but that's not a bad thing either, because when you have that millage in place, and then there's a probate judge gets involved in the committees that he appoints the committee. So it's a total different animal. But we have good services here. We have a lot of local veteran groups that really are active with what we do. We get referrals from them. We have a great relationship. So I just thank you guys for funding what we have, because we are one of the only counties that provides the flags. We just distributed 15,000 flags to our local cemeteries here in the county. And that's a general fund expenditure that no other county does that. People say, why do you guys do that? It's because our commissioners feel that that's important. And I thank you for that, because you wouldn't believe I get calls from Lenawee County. Hey, is there any way we can purchase flags from you? Because our county doesn't give them. They kind of leave it up to the local organizations or the local municipalities. So it's kind of unique there. I mean, but other than that, I'm happy with what we do here. We're one of four, but it's always fun to, when we go to these conferences, how do you guys do that? Hey,
I have a question.
Go ahead.
Do you have any Space Force veterans?
have not. I haven't had one here. Now, I did meet a Space Force veteran who transferred out of the Air Force into Space Force, and then he retired. And I met him at this conference, but he's the only one. And they were kind of joking about it.
Yeah.
But most of them are retiring out of Space Force, but they've already done their time in the Air Force and then did that lateral move when they did it. But maybe. Yeah. It kind of, I had a guy question me the other day because the flag poles that are out in front of the County Human Services Building have the 5 service flags. And I said, what about Space Force? I said, well, it's not going away. And I said, well, that's something we'll have to address. I have to maybe find, because those flag poles were donated to the county. So we might have to find a local donor to donate another flagpole. But I haven't even, be honest with you, when I order flags out of our flag for the poles, the Space Force flag is just now starting to hit publication. It's kind of, we used to be the Coast Guard. Now Space Force is the Coast Guard of active service.
Commissioner Wallace has a question.
No question, just to thank you. Thank you so much for including the Boy Scouts of America. This past weekend, my grandson was able to put the flag on his great-grandfather's grave.
That's a great thing. And I will tell you, it's thanks to you because, like I said, if it wasn't for your graces, this is one of those expenditures that you guys provide as commissioners, and I do appreciate it because the stories like that, I get a lot of those people that talk about, the opportunities, and that's what it's all about, is opportunities. And I share your heartfelt thanks for that because we get a lot of calls, kind of that same thing. And people in these local organizations, they include Boy Scouts. Some of them include some of the schools if they can come out there. We have one group got one of the sports teams that a coach was involved in, took their kids out there and helped them put graves on. I seen this morning my local Legion post. I live down in Lenawee County. They're scrambling to find anybody that'll come out and help put flags on a grave. It's like, we're organized here. They have these people that come out, and what's nice is if, like the Vietnam Veterans Chapter of America, they do one particular cemetery. They put like 1,800 flags on one. They then helped out with Hillcrest. So they're not just stopping at the ones they're assigned. They help out. So it's neat. But yeah, that's awesome. That's a great thing to have happen. And Boy Scouts lead to military service too. It's all part of it. So,
Okay, thank you. And Chair will entertain a motion to receive the report. Thank you, Commissioner Smell and Commissioner Williams. All those in favor will please say aye. Aye. Any opposed? Thank you.
thank you.
Thanks for the
Thank you,
work.
commissioners. Yeah.
If one moment, Mr. Chair, before
ahead.
you go on. Sir,
Please.
if you speak to me after the meeting, I'll give you a contact person in Lenawee County to help you get bodies to put flags on graves.
Okay.
I have access. I'm former chairman of the district for Boy Scouts. I am, and I still have contacts down there, so I can get scoutmasters to help you.
Okay. Thank you.
And now the medical examiner's office will make a presentation. Welcome. Thank you for being here.
I'm representing Dr. Mano today. He is out of town. Yeah. Dr. Mano is asking for the Board of Commissioners to approve the appointment of Dr. Bernardino Pacris and Patrick Cho as deputy medical examiners officially. They will remain as independent contractors, providing their regular services, but they would act as a backup if the medical examiner were to become unavailable. So they would help with consulting. If an MEI had a question at sea, needed to talk to a physician, They would, if the office had something that they needed to run by a doctor, we would be able to use and consult with them. Also, I was trying to think of an example to have it make more sense. Sometimes we do get phone calls from, let's say, the hospital, and they've had a death, and sometimes it's medically complicated. And if they're talking to somebody in the office or one of the MEIs, we definitely need a physician to talk to. So if Dr. Mano were to become unavailable, we would be able to use either Dr. Pacris or Dr. Cho in Dr. Mano's place. So really, it's an official backup plan. So state law allows for the appointment by the board and with the approval of the chief medical examiner for deputy medical examiners.
Thank you. Let's get a motion on the floor, and then I have a question.
Support.
Thank you, Commissioner Snell. Commissioner Williams. Just checking with administration, this is consistent with administration's recommendation. I see a nodding of head by Mr. Overton. Any further questions? Go ahead, Commissioner Bear.
Thank you, Commissioner. This is an important appointment. It's backed up by Michigan compiled laws. So to me, this is more important than a lot of other standing committees that we appoint people to. We just recommended James Ducey for the Veterans Affairs, and that appointment included a recommendation of appointment letter from the Jackson County Veterans Affairs. Can we get a similar recommendation of appointment signed by Dr. Mano for these two individuals?
I'm sure he would be willing to do that,
Okay,
put it in writing, yes.
if you can get that in time for the Board of Commissioners meeting, I would appreciate it.
Okay.
And then
Commissioner
I got a
Williams, please.
second question.
Oh, I'm sorry, I didn't mean to interrupt you. Go ahead.
Go ahead, Commissioner Bear. Go ahead.
Second page, under analysis, financial, there's no significant financial impact. Is there any financial impact at all?
Not usually, because it has occurred in the past where they have assisted us. If Dr. Mano were to become unavailable, they don't usually charge us. We have a long-standing relationship with them. They've been doing autopsies for Jackson County for many years, and they've been forensic pathologists for many years. They're good people, so I don't foresee any impact on the budget.
Thank you.
Commissioner Williams, please.
Thank you, Mr. Chair. So my question, I guess, is for administration in regards to Commissioner Bear's first question or request of a formal request. Isn't today's matter a formal request? Okay, so I don't foresee a need for a formal letter at that point.
The chair will entertain a motion from you, Commissioner Bear. Chair will entertain a motion from you, sir.
Okay, we need a motion to do just what is appropriate. I guess I'll make a motion. I move that we request.
Is there a motion, sir?
Yeah, you can see I'm looking through my documents, get the papers, little patience. Little patience, please. You can see I'm working on it.
Very good.
I move that we request that Dr. Mano provide a letter of recommendation similar to what we received from the Department of Veterans Affairs.
Thank you. Is there support? Is there support?
A bunch of horrible people.
Thank you. The motion fails for want of support.
Thanks, Jarius.
And so, Commissioner Willis, please. There's a motion to adopt the staff recommendation. Is there support? Support. Thank you, Commissioner Williams. Any further questions? All those in favor of the motion will please say aye. Aye. Any opposed?
Nay.
So noted. Motion carries.
Thank you.
Thank you, Sarah. Appreciate it very much. And now on to other business, the claims. Chair will entertain a motion to pay the claims. Heard motion by Williams and support by Snell. Are there any questions? All those in favor will please say aye. Aye. Any opposed? Thank you.
Did you get that? Nay.
Yes, thank you. Members will please take note of other minutes that are part of your board package. Council on Aging minutes and the DHHS board minutes. And sorry, it takes me a minute here to get through. We're now up to public comment. Public comment is now open again. Is there any public comment? Seeing no public comment is now closed. Committee member comments. Any committee member comments? Commissioner Bear.
It appears to me and a lot of my constituents that telephone me that I've just got some just plain enemies here. I acknowledge you as enemies, and you treat me that way, and I will treat you that way, enemy.
Any further commissioner comments? Hearing none, we stand adjourned to the